Thank you. First of all, just on the vaccine delivery, you say you're expecting some more just in time. Are there contingency plans, or are you quite certain that's on the way? I'm wondering how you allocate if you don't get that, Pfizer particularly.
Yeah, the Pfizer is really the workhorse of our program, the age-based program in particular, and thankfully it is the one that has the most reliable delivery schedule now after our unfortunate shutdown of it earlier on in February or January, February. So we do plan the clinics out, and the reality is if it doesn't arrive when it's scheduled to arrive, we have to cancel clinics. So that's how close we are doing with the Pfizer. It's a little bit different from Moderna, where we've always had a bit of contingency because it has not yet been reliably arriving at the times that it is supposed to. And again, we've heard about delays for the next shipment as well, unfortunately. And it's not anybody's fault in this country. It is one of those things that we have to work on when we have an international supply. The AstraZeneca, as you know, was one that we were targeting for workplaces and a parallel stream, but we are now doing AstraZeneca completely through pharmacies. So if people are concerned about what vaccine they're getting, if you are going to a pharmacy and signing up for AstraZeneca, you'll be getting the AstraZeneca. The age-based program, it's Pfizer primarily, and Moderna.
On the program, Dr. Henry, to reallocate Pfizer and Moderna to hotspots like Whistler, how much do you anticipate that will slow down the general age-based stream? Looking forward, how do we expect shortages of Pfizer next week, the week after? Dr. Bala mentioned that yesterday. I'm just hoping for more details about whether we are expecting that. And are there any concerns that these vaccines, Pfizer or Moderna, aren't working particularly well against certain variants?
Yeah, well, I can answer the last question first, and that's something that we look at really carefully. So yes, for every single person that we know that has been immunized and is beyond that initial period it takes for your immune system to respond, we have been doing whole genome sequencing, making sure we understand if there's been an impact. So far, we are seeing that all of the vaccines that we have are working well against the viruses that we are seeing circulating in BC right now. That includes all of the variants of concern. So that is good news. Obviously, we will continue to watch that carefully, and that's the focus of our whole genome sequencing program, one of the key foci that we'll have over the next little while. So the shipments of Pfizer that we are expecting to receive over the next few weeks, the peak was last week, this week, and next week, and then we have smaller numbers. But we also know that we have Moderna coming, and it comes in various ways. We also know that there's a whole lot more vaccine that's on order, and we don't yet have the understanding of what May is going to look like in detail. That's one of the challenges we've had with this program across the country, and it's a product of the fact that we're getting vaccines from other countries. And so it really right now what we need to do is address in every way that we can, both people by age, which we know is the highest risk, but also those hotspots and outbreaks where we can prevent transmission in the community. So it's not going to measurably slow down so much as target different people at different times. And yes, it will have an impact, but not an impact that is it's measured in days as opposed to weeks or months. And I will say as well that the vaccine that we have, the AstraZeneca we have for people who are over age 55, this is an opportunity to get that vaccine quickly, and that will help us when we get to that age group in the coming weeks. So it is a balancing, and yes, it makes us all anxious, particularly on Monday afternoons. If Pfizer doesn't come in as scheduled, then we just need to postpone clinics. But we need to get vaccine into people's arms as quickly as we can across the province, but really focusing on those areas where there's highest risk. And that's why we've restarted, particularly first responders, looking at school staff and childcare in those areas.
Just precisely to what Dr. Baum said yesterday as well. At its height at the end of March, in that period leading into the end of March or at the beginning of April, we received in some weeks about 161,000 doses of Pfizer. This week, next week, the week after that, we're expecting about 138,060 this week, but between 138 and 139,000 doses. We expected the 105,900 doses we're getting this week of Moderna last week. We are very confident we're going to get it this week. And then next week we don't get any Moderna. So this is part of the management of it. It's not a question of a shortage. We would like to get, they could say, any number you could name, extra doses, we would take it and we would administer it right now because there are 4.3 million people eligible, and to date, just over 1 million people have received their first dose of Pfizer or Moderna or AstraZeneca. So that's the situation right now. It's not a question of being a shortage. It's what we're expecting to get and what we're having to plan with in the next couple of weeks.